red, white, yellow, green, brown, gray. No, these are not just colors of Lamborghinis, but possible colors of our vaginal discharge that we can have throughout our reproductive cycle. Please stay with me to the end of this episode to find out the vaginal discharge that you should worry about and how to handle it. Hi and welcome to Triple F with Dr. OBeLs. Please remember to subscribe to my channel by hitting or clicking on the subscribe button and turn on your notification for our weekly fresh episodes. Content include obscene graphics. Viewers' discretion is highly advised. Our vagina has glands that produce fluid, which mixes up with the cervical mucus, bacteria, and cervical cells to make up the vaginal discharge. This is absolutely normal. I, like most women in their reproductive age, produce daily half to 1 teaspoonful of vaginal discharge, which is responsible for cleansing our vagina, protecting it against microorganisms, and also lubricating it during sexual activities. If you're worried about how your normal vaginal discharge should look like and feel like or smell like, you should know the 4 qualities of a normal vaginal discharge. Look at the consistency, which is thin and watery or thick and sticky. The color, it can be clear, white, off-white. The quantity, it can be large or small in volume. The smell can have mild to non-existent odor. The appearance, composition, quality, and quantity of a vaginal discharge varies between individuals and all through your menstrual cycle and during your reproductive life. And this is usually dependent on the amount of progesterone hormones and estrogen hormones in our body. For instance, at the end of our period, the vaginal discharge is brownish. Few days immediately after our period, some women experience dryness, but after several days, the vaginal discharge increases and becomes whitish or yellowish and can also be sticky. Few days before ovulation, the mucus consistency increases in quantity and becomes watery and elastic with a creamy appearance. During ovulation, it becomes egg white in color and consistency. Days after ovulation and before our period, the discharge is less but becomes thicker. PHYSIOLOGIC LEUCORRHEA, which is a whitish to yellowish discharge with a thick or thin consistency that has no smell or a mild to musty smell, usually occurs during pregnancy, in adolescent girls that just started seeing their period, and in newborn girls. With knowledge of these, an abnormal vaginal discharge becomes very easy for you to detect with change in color, smell, amount, and consistency. You can also have associated symptoms like pain during sexual intercourse, burning sensation, lower abdominal pain, rashes, itching, and soreness around your vagina. These are usually due to 5 major factors. What you insert into your vagina. This ranges from pennies, dildo, tampon, cucumber, and your fingers while douching. What you use around your vagina. This involves scented soap, creams, gel, vibrator, tongue, bubble bath, or even a scented pad. What you wear, like tight-fitting panties, thongs, and non-cotton underwears. Medical conditions including cervical polyp, endometrial cancer, cervical cancer, vaginal cancer, diabetes, and reduced immunity like in HIV, medications involving the misuse of antibiotics, intake of oral contraceptive pill, hormonal replacement therapy, and the use of steroids. While the unprotected penis and tongue has the potential of transferring varieties of STIs to you, which usually presents with a smelly vaginal discharge, the use of other products in and outside the vagina has the potential of causing 2 major kinds of infection. One of them is bacterial vaginosis, which usually presents with a fishy-like smell, and the other yeast infection or candidiasis usually presents with itching and burning sensation with a cottage cheese-like appearance of vaginal discharge. Medical conditions will require you to go to the hospital where you can be asked several questions and your history taken, and you can be examined with appropriate lab investigations done to make an accurate diagnosis so that the best form of treatment can be instituted. If you are abusing antibiotics, you need to stop. For sexually transmitted infections, treatment can either be through the administration of antibiotics or antifungals depending on the cause. And this can be in the form of tablets, vaginal pessaries, creams, or gel. However, in most cases, changing certain habitual practices that usually constitute your normal vaginal hygiene, as explained in my previous episode, why your vagina stings, can actually resolve that abnormal vaginal discharge. Please drop in your questions in the comment section below, and you can also share with me mental, physical, and sexual health issues that you're dealing with and you would like me to talk about in one of my episodes. Do not forget to subscribe and stay tuned for a fresh episode, same time next week, Friday. Bye!